as well as aesthetic services. We've been open for about 3 years.
6 years.
Oh yes, 6 years. We've been open for 6 years and we just blessed, bago na mo i-bless ang expansion sa clinic.
So what do you mean by neurologic services?
Neurologic services, this will be adult neurology. Common diseases like Parkinson's, dementia, ulyanin, kalimot, stroke, headache, spinal cord diseases. And something we have different in our clinic is we offer botulinum toxin injection. Not only pa-beauty, pa-bata, pagpugong sa edad, but we also offer botulinum toxin injection, kanang botox, for neurologic conditions, sama sa pagtuskig, abnormal na pag-lihok sa naw, sa mata, so spasms. So we're the only center, the only clinic around which offers that service in a one-stop shop sa Ragit Kapisitan.
Services also, we offer the acne treatment, usually for the juniors, the teenagers, also the adults, as well as the scar treatment, acne scar treatment, and the mga weight loss, kanang gusto karon muscle contouring. So we have machines, no, like our Embody, which are also found in the bigger aesthetic clinics. For the Exilis, it's one of our best sellers because it's from head to toe treatment. So the indication is for the wrinkles, weight loss, fat reduction, as well as lifting. We have a lot of facials depending on the skin type. Like if your skin is sensitive, we have the PMB hypoallergenic facial. We have Lumafirm if you want lifting as well as the tightening of the skin, and gentleman's facial for the males.
So we also introduced the junior facials because we have to remember that during adolescence, kanang magulitaw, magdalaga, that's a period wherein mag-awa sa mga bugas. So we have those special facials here, and we have very, very effective acne treatment packages here in the clinic.
We gathered the before and after pictures, so I can share it with you. It's right there, no? Like I have a patient from Talagyat pa. She goes here every 2 weeks just to have her facial. So after 4 months of treatment, not one acne. Wala na jud, nawala jud. Yeah, but the before treatment was really lang siya acne, but it's really abscess all over the face, including here, no? Behind the ears. So we've had, I used my being an internist combined with a skin specialist to treat that patient. Kay di man na, kay nana naman siya. So with a combination, I treated her in 4 months, and up to now, not one acne, wala na jud ang iyang skin. I also have like a patient from Argao, no, who has the same problem, and the same thing. I treated him within mga 4 months, and after up to date right now, what na jud siya acne. So what we're treating him right now is the acne scar na. So my aim really especially for the teenagers is to really control the acne or the pimples to prevent the scar, because it's more difficult to treat the scar compared to the acne.
You have to actually think of it this way, that kaning skin health is not just for beauty, but it actually affects someone's self-esteem, how we feel about ourselves. So our health is not just our internal organs, but also how we look outside. And nowadays, lifestyle diseases, daghan na gyud kay mga sakit na nabot karon. If you notice when you come to our clinic, the moment you step foot in our clinic, the ambiance is very different. It's very cozy. It's very relaxing, because that's what we want our patients to feel. The moment they arrive inside our clinic, they will have this feeling that they are relaxed, they are at home, and we will address not only the neurologic and internal medicine diseases, but as well as the complete holistic health, which includes our skin health and how beautiful we are, not only outside, but also inside.
So we have also charity patients. Like there are times na mapil na mo nga naglisod gali ang patient, to the extent na mo ana gali no pila man PF. So usually ako personally, I don't give any PF for my patients. Even if they majority of my patients, they do also after the consult facials and other services, but even if they don't avail of that, I do not, hindi ko mag-PF. No, it's just my way of giving back also to the community. So I don't ask ever since I started my clinic. And then our matouch magugas sa charity patients ba kay they tell me na before the treatment mag-mask kon siya with me. Yeah, after the treatment bilak lagi sila kay wala naman siya pimples sa doc. For the first time I did not wear my mask. Kanang ana gali. So aesthetic is not just pang beauty or kanang like before mo ana sila ay pang ano na very yeah, you're very vain. No, karon dili man kay those patients they go to the aesthetic clinic, makita man sa mo no na they come here doc, kabangi taong kudok, gabi, wala ni hope kanang ana ba. And it's such a nice feeling when you tell them, "Oy, don't worry, sus kanang kaya na naara jud tay hope ha. Basta follow lang jud ana ba no." Lahi kay nang appealing nila and like mo reminisce sila ba back then nga sus mag-facial ni murag ni nanganak sa pikas room kay musakit jud siya sa kasakit. Lagi ang akong patient before musakit niya. Kana bang doc ayuhan lang jud ko doc, ayuha but karon okay na jud yung skin. Makita mo ang pictures na adjud ang pictures and then the beauty of that is dili siya nga na okay lang siya 1 month, 2 months, na okay siya like for 2 years, 3 years, asa tong before and after pictures na to. Ana ba na okay jud siya. Ana and
Di na siya mabalik kung ma-okay na.
Kuan, ang ako lang yung advice is to come here once a month for facial. Kaya actually, the recommended jud is once a month facial. Even if you don't have pimples, it's like a general cleaning sa akong face pa. It's as well as age-defying. So, wag mo kabaluan na sa una. No? But as you've noticed, the earlier you take care of your skin, mas ma-prevent na to ang aging process. So, muna ang ganahan ako is to educate these teenagers na ang uban mo anong good normal na yung bugas kay teenager di ba anak man ta sa una ay normal na
migraine, tension, headaches. The important thing there is you get consulted kung nakaibatihon because headaches can be a minor symptom of a much more severe or even drastic disease. And something very important is when they come here to the clinic. I'm also an educator, maestro na ito. So I always make it a point that when the patient as well as the family is there, to educate na itong people family that they know what are the warning signs, kung saan man natin mailan, what are the red flags. Aside from headaches, another thing which I see a lot is memory lapses, kalimot. So I usually do if a patient is high risk, patient reaches at least 40, 45 years old, I do the screening for dementia. I do it earlier than usual. Stroke would be common, but it's usually seen in the inpatient and ma-admit, but we usually see patients after. The difference we have here in the clinic is when we give injections, Botox injections sa mga post-stroke patients, stigma na complications silang stroke, it's not only debilitating but it's also painful and it does affect the mental state of a lot of our patients. At hindi nila mag-hold tungkol sa kasakit. Okay, so I address it. That's the advantage when we have a background in internal medicine. So we see the holistic, the full picture. So tibuok ang among pag-address sa sakit. So when we give the injections here, similar to what Dr. mentioned about charity cases, we also find a way that even if this medication might cost a certain amount, mapangitaan na namo paagi. I have what I call the Botox clinic. Magsulod na 5, 6, 8 siyang ka pasyente magdungan, and that's what I practice called vial sharing. So instead of it comes out cheaper, and if I really see that the patient maglisod yun, ingon naman ka na iampo lang mi mas grabe atong grasya makuha, we will inject them. Inibalik anak 2 weeks, 4 weeks after, you can see lesser the pain, mas makatong dito skin, and they start getting that sense of hope. Balik na yun.
Yung yun, Doc, na kanang dementia.
Yes.
Sa may angay na...
Ang usual na itong symptom, Ana, is misplacing things, kalimot sa mga pangalan sa mga tao. Nanaman kayo ng factors, Ana, age would be the greatest factor. Now, when there's what we notice man in our country, sometimes may unta normal naman na siya. Sa katuwang, kalimot. Personally, I would disagree with that. Yes, it's normal to forget things, but once you start forgetting things, memory lapses, your cognition is affected, and it affects your activities of daily living. Hindi na makatrabaho, sakto, ba ng relationships mo affected at home, there's behavior. So, by the time they reach us, medyo moderate or advanced na. Kailangan magutal, we have to be on the preventive side yun. And one is regular check-up. Okay? If you have labi na kaliwat sa family na Alzheimer's, na dementia, or if you notice mas frequent na lagi ni akong kalimot-kalimot, check up that. We have bedside procedures, mga validated medical instruments na interview o pag-examine sa complete neurologic exam. Madakpan na nato early kung kinsa ang may posibilidad na dementia.
Say an advantage in early detection.
Oh, the earlier the detection, we get to work up the patient, and once we come up with the diagnosis, if it turns out that it is dementia, we can have early intervention to prevent the disease from progressing. And something which I take time to do is, dapat ang pamilya kompleto gina. Usahay na atay kulyanin sa pamilya. Dementia is close to my heart because my grandmother also had dementia. Sometimes it's actually the family members who don't understand what's going on. Ano pabalik-balik sulti man si Lola, nagpa-form ako nangutana naman ko balik. So we have to educate, and also the caretaker. I always talk and educate the caretaker. Kaya ma-burn out na po nang nagbantay sa pasyente na may Alzheimer's or dementia. Ako lang yung klarohon, we have what we call mild cognitive decline. Hinay-hinay ng kalimot. Once the activities of daily living, normal functioning maapektuhan na, and that's dementia. Ang most common type of dementia is Alzheimer's. But dili tanan dementia, Alzheimer's. So we believe in holistic treatment as well as the education part. Importante yun kailangan prevent. And we don't wait for diseases to come. So just because we go to a doctor doesn't mean we're sick. The important thing is we go to a doctor para we want to maintain a sense of wellness. And this clinic here actually has basically the wellness, the neurologic side, the aesthetic side. If you look at it, wellness, even the World Health Organization, ilang i-define ang health not only the absence of disease, na physical, but it also includes our social well-being, our mental well-being. So, dapat kompleto din siya man. Sa tanan, we'd like to invite you to the newly expanded and renovated clinic, Beauty and Brains, Neurology, Skin, Aesthetic, and Medical Clinic here at Perpetual Succour Hospital.
Great promos here. We have 50% discount of our Exilis Elite 360, as well as our M-Body promos for our M-Body for muscle contouring. So you can call us in our clinic 0923-526-5815 and book your appointments with us.